Thank you for joining us. I know 7 o'clock is hard. It is really my pleasure to welcome all of you to today's event, to celebrate Nurses Week as part of the 10th anniversary celebration of the College of Science and Health. Today is Florence Nightingale's birthday, the National Nurses Day, or the last day of the Nurses Week. During this week, we honor and celebrate all nurses and the nursing profession for the contribution nursing makes to the healthcare and the society at large. DePaul University School of Nursing has been preparing nurses since 1947. We graduated around 200 pre-licensure and post-licensure students each year. Many of our graduates have become phenomenal nursing leaders in practice, making significant impacts to patient care and nursing and the nursing discipline. Tonight, we're featuring 4 such nursing leaders who are DePaul alumni. They will be discussing their journey in nursing practice through a facilitated panel discussion. So let's hear about their stories. Dr. Shannon Simonovich, assistant professor in the School of Nursing, will facilitate the panel discussion. Dr. Simonovich.
Thank you so much, Dr. Lee. Thank you to our event titled Nursing Pathways from Bedside to Policy, where we feature distinguished alumni who are making an impact. Our first panelist this evening is Dr. Yolanda A. Coleman, who is an influential leader in the healthcare industry. Currently, she serves as the Vice President of Patient Care Services and the Chief Nursing Officer for Midwest Regional Healthcare, CTCA. Dr. Coleman graduated from Marquette University in 1996 with a bachelor's degree in medical technology and a minor in chemistry. She earned her master's in nursing from DePaul University, where she serves as an executive board member for the Black Alumni Association, E.Z. Taylor Scholarship Foundation, and the Illinois Nurse Leader Association. In 2012, Dr. Coleman received her doctorate in nursing from the University of Illinois at Chicago. She is also a certified nurse executive and a member of the American College of Healthcare Executives. While maintaining a balance as a mom, professional nurse leader, and educator, Dr. Coleman continues to carry out her service to the community as she teaches students and serves as a mentor for young girls and women. Thank you so much for being with us, Dr. Coleman.
Thank you.
Our second panelist this evening is Dr. Rita Alue. Dr. Alue is a clinical research advanced practice nurse at the Institute for Population and Precision Health at the University of Chicago. Dr. Alue has worked extensively in clinical research. She earned a master's degree in epidemiology and biostatistics from the University of Illinois at Chicago and earned her doctorate here at DePaul University. She is currently working on colorectal cancer and Johnson & Johnson COVID-19 vaccine trials at the University of Chicago. We welcome Dr. Alue to our panel this evening. Our third panelist is Dr. Cheryl Soko. Dr. Soko is an advanced practice registered nurse who earned her Bachelor and Master's of Science in Nursing from Loyola University and her Doctor of Nursing Practice from DePaul University. She currently practices as a nurse practitioner in the emergency department at Northwestern Medicine in Chicago. Her experience in emergency care spans over 2 decades as a nurse practitioner in community-based and major metropolitan medical centers. Dr. Soko is also adjunct faculty for the DePaul University School of Nursing with interest in research and program development that focuses on transitions into practice and interprofessional collaboration in healthcare to address knowledge disparities and improve patient health outcomes. Welcome, Dr. Soko. And our final panelist for this evening is Dr. Christopher Toribio. Dr. Toribio was born and raised in Skokie, Illinois. He graduated from the University of Illinois at Chicago in 2011 with a bachelor's degree in psychology and a minor in chemistry. He went on to attend Indiana University, Purdue University at Indianapolis, and graduated with his BSN in 2013. His career at the bedside took place at St. Joseph Medical Center in Joliet, Illinois, where he worked on the CV/CICU for 3 years. He then earned his DNP and CRNA training from DePaul and North Shore School of Nurse Anesthesia, respectively, in 2020. The focus of his research was on the use of fiber optic intubation simulations to enhance skill and confidence among anesthesia providers. He is currently employed as a CRNA at North Shore University Health System. Thank you for being here, Dr. Toribio.
Thanks for having me.
Wonderful. So the first question that we have for our panelists this evening, and we would love to hear from all of you in any order that you decide, could you each share with us about your nursing journey and how you got to these distinguished positions?
Sure. So I graduated from DePaul University from the master's entry program in 2005. During that time, as I was graduating, I looked for a job. I got a job as an ICU nurse at University of Illinois. And I was encouraged to also apply at that same time to the PhD program at the University of Illinois, Chicago, and I did do that. So I became an ICU nurse at the same time as working on my doctorate degree at UIC. I spent numerous years, a total of 10 years at UIC, and my trajectory went from an ICU nurse to a nurse educator, and then to a director of patient care services. And during that time, I also spent some time in infection control. When I first became a nurse, I was very passionate about wanting to be an ICU nurse. And I think that has helped me a great deal, even in my leadership career and in my career as an assistant professor. I then after moved up during the ranks in leadership, stayed on the leadership track, and became assistant CNO. And then shortly after that, I became a CNO. And all the time I did my leadership track, and I kept also with my professorship as being an assistant professor, also at the part-time level in my career. And I also spend a lot of time in the community. Community service is very important to me. I feel like my patient care years have helped me a lot with that. And I am also on different boards that relate to a nursing profession. And now that I'm more in the senior executive leadership level, I also am on some executive boards for healthcare.
Thank you so much, Dr. Coleman. I have to ask for students attending this talk, what led you to pursue your PhD in nursing?
I was initially encouraged to do that. And, when you're graduating with your master's, that's really your initial focus. You're not necessarily thinking about the next degree before you even get to your real full nursing first job. But at that time, I was encouraged to do it. And, I was a mom of a toddler at the time and a full-time ICU nurse. And sometimes when I look back on it, or I give talks, I say, sometimes I don't know how I did it, but I did it. I thought that I did have a passion for education and research. I did understand that earlier on at DePaul with some of the projects or papers that we had to write. So that influenced me to have that passion to move forward to my PhD, because I knew in the future I would want to be a part of research and education.
Fantastic. Thank you for sharing. How about our other panelists? Will you tell us about your journeys?
Sure. Greetings, everyone, and happy Nurses Week. So for me, I currently have 20 plus years of experience as a nurse. Like many immigrants and people of color, my nursing journey was not as straightforward as one might expect. I initially went through the associate degree in nursing and worked for a couple of years to gain some clinical skills. Then I went back and completed my bachelor's in nursing at a 4-year college. I then worked for a little bit more than a decade as a labor and delivery nurse before going back to school to earn my master's degree. Rather than pursuing a master's degree in nursing, I took a different route and received a master's degree in public health, focusing on epidemiology and biostatistics. This allowed me to become a research nurse at North Shore University Health System in Evanston. I just want to underscore this, that you do not have to have your master's in public health to be a clinical research nurse. Not to digress, let me go back to the question. So this allowed me, having all this as schooling, allowed me to end that, to get that job. Okay, but this experience, the experience I gained from the school at work that I did, and also on the job, these two combination became very useful to me during the pandemic period. Finally, I decided, I think I was working for one of the primary investigators, and also having so many years of nursing experience. And this investigator approached me and said, you know, you are so smart. Have you thought about earning your PhD? But I'm looking at myself, because I do have 3 children. I still haven't paid off my master's degree student loan. So we're hearing it from some of the residents that, oh, Rita, you know a lot about research, you know. It would have been nice if you can be on the table, you know, at the table when we make those decisions. So I decided that I think I need to go back to school and advance my nursing career. So I went ahead and applied to DePaul University and completed my DMP degree here at DePaul. As you can see, it has not been the most straightforward path to a DMP for me. If I had had a mentor when I first started nursing school, I probably would have had a more direct pathway. So it took me a long time, but I made it.
Yes, you definitely did. I do have to ask, how do you feel like your trajectory from associates to bachelor's, you know, to master's within epidemiology and then coming to your DNP, how do you think that informs your perspective that you now bring to the table as an APN in your role?
Oh, I would say, thank you, Dr. Simonovich, for that wonderful question. Yeah, I will say that really helped me in the sense that I was able to use the fact that I know patient, I can talk to patient at the bedside, and knowing the research aspect of me working as a research nurse, I was able to combine those two and be able to use that to leverage my career as a clinical research nurse.
I do have to note for our panelists and for the audience that Dr. Alue was one of the research nurses that was collecting samples from the very first COVID patients that presented to North Shore. So I'd like to thank you for your bravery in doing that. You have never stepped away from a very exciting and cutting edge opportunity. I really admire you for that.
Yeah, thank you. I remember all that about the covalescent plasma, even though we found out that it wasn't a good therapy that we can use, but at least we started collecting the plasma right from the day one of the pandemic. Yeah. Thank you.
How about Dr. Soko or Dr. Toribio?
I'm happy to go. I just want to say Happy Nurses Week to all, and I am both humbled and honored to be part of this panel, this very impressive and experienced panel, so thank you for inviting me. My nursing process or trajectory seems to follow a little bit more of a straightforward path. As you know, my background is primarily in emergency nursing. I started off in the intensive care unit and was recruited down to the emergency department at St. Joseph's Hospital. my first year out of school. So at the time, it was during a really difficult time to get a nursing job. And since I had done an internship at St. Joseph's, they gifted me with an opportunity to work in the ICU as a new grad. And then I was recruited down into the emergency room, and I've been there ever since. I found my passion and my love there. So I've been able to evolve as a practitioner in that area, that specialty area of practice, which has really been continuing to excite me and humble me every day. So, like I said, I started off in the emergency department at St. Joseph's. I knew that I wanted to advance my practice into more high acuity. So I transitioned and moved over to Loyola University, which is a level 1 trauma center. During that time, I had a lot of engagement with many advanced practice nurses. I was able to, they were able to mentor me and really guide me in the direction of pursuing my dream of being a nurse practitioner. And so I was very fortunate to have a lot of experienced nurses who were really pioneers in acute care as advanced practice nurses at the time, and gave me great insight on how I wanted to kind of move forward in my career, not just in the first few years, but long-term wise. So I was really fortunate. After I graduated with my master's, as you many of you probably know, the ER is very small. It's really just 1 degree of separation. So luckily, I was able to land. I was recruited and actually asked to come to work at North Shore. It was through just a coincidence that a friend of a friend said, "Hey, I have a friend who just graduated and she'd be great in your ER." And so in that time, it was really, again, nurse practitioners in the emergency department were very new, and it was a tricky slope because the physicians were very cautious on what we can and cannot do in the emergency department. So we really evolved that practice, especially in that department. They were very welcoming, and we had a very cohesive, collaborative group that really supported our practice and saw the benefit and our competence. And so we initially kind of evolved that practice into just seeing minor things to being in the main room, and then evolving more to going to all the different locations within, at the time it was Northwestern, but we eventually ended up in a lot of different areas. So it was beneficial. I think in that environment, I had I was lucky to have a lot of great mentors who took me under their wing, saw the potential that I had in that area, and really helped me thrive. So I continue to kind of look back, especially when I'm teaching students, that if you just have one person that really believes in you, um, it's really important to cultivate that relationship and encourage progression, because you never know what that can do for that person moving forward. Not, you think that you want to help everybody, but it really does make such an impact on their future trajectory, and how they want to move forward in nursing. So um, after North Shore, I was, again, people must be talking about me, because then I got recruited downtown to Northwestern, and I was asked to help develop one of the first observation units in the city, if not in the region. So we started off as the initial observation unit from the emergency department. So me, myself and my partner really kind of cultivated this new innovative program where we were able to develop an observation unit within the emergency department, and we grew from a 5-bed unit seeing minor short stay kind of issues, and then now have developed it into a 23-bed unit that now has been adopted throughout the whole institution in different specialties. So oncology, cardiology, hospitalist medicine have all modeled off of our initial program. So we've really kind of helped evolve how APNs work, at least at Northwestern. And I know that it's been kind of nationally adopted in a lot of different institutions. So I feel like we're very proud of that achievement, especially since it's benefited advanced practice nurses to be able to practice at such different levels in different areas. Um, so, that has been a lot of of work of what I've been doing. We've been kind of progressing our group at Northwestern. It is a residency run program. So pioneering APNs in the emergency department in a residency run youth institution is difficult, but we again have been really determined to work well and collaboratively with our physician colleagues, and now have developed our group from just my partner and I to a group of 18 where we cover the whole emergency department 24/7 in all different areas. So from acute care to observation to trauma to ICU medicine. So we've really grown. That's taken quite a long time to kind of evolve. So it took me a little while to decide to go back to get my DNP because I've been a little busy. But I felt the potential of the leadership and how I can make an impact on how nursing, advanced practice nurses can practice in the emergency department. So that really motivated me to go back to school and get my DNP because I really felt that I needed the education to be able to sit at the table and help make decisions on how we move forward in contributing to the healthcare system. So it's been fun. And I've been doing a lot more research, which before had scared me. But I've been surrounded by great mentors like Dr. Simonovich, who really kind of mentored me in a way to really love and appreciate and want to participate in research moving forward.
Thank you for that compliment. I do have to say what you guys have modeled at Northwestern is really exemplary. I have one question I have for you is, did you always know that you were passionate about emergency care from the very beginning, even as a student, or is that something that you kind of grew into naturally over time?
I always knew that I liked high acuity, and so I really thought ICU was where I wanted to go. But then when I got recruited into the emergency department, it just fit so well with my personality and my desire to continually learn. I mean, every day it's evolving. There's not one day where I think, I know this is going to be an easy day. I'm shocked every day and humbled every day, which is why I try to kind of instill that not only in my students, but in my kids and everyone, in the nurses that I work with, and especially the nurses that are trying to decide if they want to go to be a nurse practitioner or advanced practice in any other area. This is really something that you're a lifelong learner, and this is the best way. This is a great way to kind of give back to your profession and the people that are following you, because you're not just representing yourself, you're representing the whole profession. And so you want to kind of make it better than when you found it, is usually kind of my go-to when I speak to them. And it helps, and I've seen them evolve, and it's exciting. It re-energizes me every time I see one of my students come back as either a staff nurse or come back as a consult as a nurse practitioner. So it's like continually.
It's a very rewarding experience.
Agreed.
It's one of the best feelings ever. Dr. Toribio, can we hear from you about your journey?
Yes, absolutely. So first, I just want to echo what everyone else has been saying and say Happy Nurses Week to everybody who's attending. And it's also truly an honor to be included on today's panel. So thank you, Dr. Simonovich, for thinking about me and reaching out. So a little bit about my background. I said earlier, I was born and raised in Skokie, Illinois. My parents immigrated here from the Philippines, and my mom was a nurse. So being raised in an immigrant family, my options were either going into healthcare, going into accounting, or going into engineering. So I went ahead and chose a healthcare route, and I was actually initially pre-med. But when I went ahead and shadowed in several different settings, one of the things that I noticed was that I didn't have the opportunity to really connect with other patients as much as I would have liked. So I actually went ahead and decided, maybe nursing is actually the better route for me, with me being a social person, wanting to really develop strong connections with patients. And I felt that pursuing a career in nursing was something that would be able to fulfill that need for myself. So I went on, graduated with my degree with psychology and a minor in chemistry from UIC, and then went on to enroll in the second degree BSN program over at IUPUI. When I graduated in 2013, as many of you guys know and remember as new grads, after countless applications being sent out, I was finally hired onto CVC ICU over at St. Joe's in Joliet. They had a new grad nurse residency program, and I was lucky enough to have the opportunity to also join the ICU as a new grad. There, I was thrown into the fire and often way and over my head. But in that process, I really grew to love and respect the attention to detail that was required to care for critical patients. We often receive patients directly from the operating room. And one of the days I was encouraged by one of the CRNAs to actually shadow them down in the OR. There I was, my eyes were completely wide open when I saw them down there. I was in awe of the combination of chemistry, biology, pharmacology, and physiology, as well as the well-rounded clinical capabilities that they had and regularly used in practice. So I went back upstairs, went on to be part of the Clinical-Based Leadership Council, helped develop the protocol that gave the bedside nurses on our unit the autonomy to extubate our postoperative heart patients without the need to call our intensivist first. And went on to also pass my CCRN exam and then subsequently apply for anesthesia school. So I started anesthesia school down in 2017. And along 3 years later, graduated from DePaul with my DNP, passed boards, and have since been working over at North Shore as a CRNA as of December.
Fantastic. Thank you, Terry. I have my first question for you is, how did you choose North Shore School of Nurse Anesthesia for your training?
You know, that's a great question. And one thing to I would want people to keep in mind when they are applying to graduate school is, even though you're getting invited to an interview, it's also an opportunity for you to interview the school that you're going to be going to. So one of the things that I knew was that I was going to be spending the next 3-4 years with this cohort, and I really wanted to make sure that I had both the support as well as the resources that were available on behalf of the school to make sure that I graduated with the best capability that I have possible. So doing so, I knew that they had a lot of really diverse clinical experiences that they had to offer their students, as well as really supportive staff. And truthfully, very early on in the interview process, I had a really good feeling about the school relative to some of the other institutions that I had the opportunity to interview at. So it was a pretty easy decision.
That's wonderful. Yeah, we hear that a lot every year at the open house. There's a special chemistry and a specific level of support that you can expect at North Shore. It's not often that I get to speak to our CRNA grads, so I have a question. As faculty who taught a lot of your DNP courses, how do you, since I'm not sure if the whole audience knows, all of the CRNA programs across the country have matriculated to a DNP level for graduates. So I'm curious to know, in what ways do you use your DNP training from the DePaul side of your doctoral education in your clinical role as a CRNA?
Well, I will say specifically with regards to the fiber optic intubation, I would say that simulation directly correlates with our clinical practice, especially with certain patients where we're undergoing anterior spine surgeries and things like that, where we have to really make sure that we don't really manipulate their neck and their head too much. With regards to my own personal DNP project and using the fiber optic scope, I would say that that's used pretty regularly.
That's wonderful. I'm so glad to hear it. It's wonderful when your clinical research projects as doctoral students can relate to your roles in advanced practice. My next question for all of our panelists is, what support or inspiration do you find most beneficial in helping you achieve your goals?
Okay, I can take that. I can take that question. That's a very interesting question. So for me, DePaul provided me with an excellent guidance and mentoring that helped prepare me to the level that I'm at today. I would say in most cases, the instructors are available and are willing to help address any issues students were having. As far as my inspiration is concerned, I think nursing is a profession that is driven by a passion for patient care. I personally love helping and caring for people, and these characteristics clearly reflects who I am, and it has continued to define me throughout my nursing career. Thank you.
I can also add to that. I've got to completely echo your thoughts in terms of really wanting the desire and the compassion to want to really help patients. As I've mentioned before, a lot of my inspiration is also with the team. We're very team-based in my department, and so I really feel that being a major contributor to how we're advancing patient care, how we're helping them in terms of not only health disparities, but in terms of like providing care and being supportive in just a multitude of ways. We want to make sure that we're involving the whole group and we're being inclusive to not just the providers but the patients in terms of their goals for outcome. And so my inspiration is not just the patients, but also the staff, because I really want to feel that I'm being a valuable contributor. And a lot of them, like I said, you're modeling the highest level of practice, and so you want to represent that role in the best light so that it gains the respect that it deserves, and with all the hard work that we're putting in, not just from the patients, but everyone that you're working with, because there's a spotlight on you all the time. And despite all the advances that advanced practice nurses and nurses in general have made, there's still definitely a disparity in how things are um, distributed, whether it be responsibility, procedures, um, acuity. There's still things that we're striving to play at a same level that our colleagues are playing at, when we've proven that we're capable of taking care of these kinds of patients. And then, you know, the other main support too is really family. For me, is my inspiration. I have two. I don't want to say young, because in my mind they're like 3 and 5, but they're much older. Um, I want to really instill in them that lifelong learning is invaluable. That knowledge, education, experience is something that you will always be benefited from, and something that no one can ever take away from you. So even though they know that I'm doing well at work and I don't have to go back to school, and why are you up writing this paper or doing this, whatever it is that you're doing on your days off, that doing the best in the profession that you've decided to choose is giving the profession the respect that it deserves. And whatever you do, you should be doing it at your best. So it's really, it's a multitude of inspirations for me. That and my short attention span to wanting to be involved in a lot of different things has also kind of helped support this constant moving forward. Like I very rarely very static, so it helps to kind of have a lot of things to be dabbling in.
Thank you, Dr. Soko. Dr. Coleman, what support or inspiration do you find most beneficial in achieving your goals?
My inspiration is definitely driven by my passion for what I do every day, being an advocate for patients, looking at health disparities in community and trying to improve that, being a part of policy decision making in healthcare in general. Also being inspired by patients and families, looking at ways from my team on how to improve our patient care, how to improve situations in the community. I'm always inspired. I always say I'm a nurse's nurse, no matter what level I'm at. It's very inspiring to me. I'm one of those people that drive around with the nursing license plates because I'm very passionate about what I do, and I could not imagine doing anything else right now at this point in my career. Although my career didn't originally start out as a nurse, I my career has become full circle. The reason why I decided to become a nurse, I worked in a cancer center as a medical technologist when I graduated from Marquette. And I was assisting physicians with bone marrow aspirations. And I would get to learn and be a part of the patient care. And I felt as though I wasn't having the opportunity to do enough with the patients. So at the time I was in Atlanta, I moved back home here to the Chicago area and found out about the DePaul program and decided to apply to the DePaul program, became a nurse. And all of these years later, my current career is back at a cancer center where I'm helping oncology patients more at an executive level, but it really has made my career come full circle, the way I started out and the way I currently am. And my support comes from a lot of different venues, the support of others in my network, nurse leaders, my staff, the community, definitely my family. As we all know, last year working in COVID was the most challenging time of my career, I would say. And then, I had the misfortune of having family members. So you're wearing your hats as that nurse leader in my case. And then I am also wearing that family hat to ensure that my family gets the best care possible and helping them through that as the healthcare person in the family. So support and inspiration comes in many different ways. And I always, no matter where you are in your career, I suggest having a network. Also, as a student, joining committees, getting on boards, that's also a very helpful network. This is a network, you know, being an alumni of DePaul and being able to speak to others after I've been successful in my career. I think that's a way to support others. So I'm always looking at not just help or support of myself, but how I can give back to the more novice nurse and help support them through their career trajectories.
That's wonderful. Thank you. Dr. Trivia, what inspiration is beneficial in helping you achieve your goals?
You know, I just want to say, I think it really comes from truly how lucky we are to have the opportunity to have a positive influence on people's lives on a regular basis when we care for our patients. I think that's truly something that continues getting me going to work every day. And I know I said earlier that, you know, the reason why I went into nursing in the first place was I felt that I had the opportunity to build a connection with patients more so than any other field that I was considering at the time. And while I don't necessarily have as much of an opportunity to do that now in the OR, just having that 5-10 minutes to really build the level of trust in a patient that's required to for them to have in somebody before they go through surgery is something that still kind of keeps me going. Um, you know, during school, we had an opportunity to go to Honduras for a medical mission trip. And I would say even going out to there, you really understand the disparities in a lot of these underserved populations where they don't have regular access to healthcare. And I think that being able to utilize the skills that we have as nurses to be able to provide this type of care for patients that they otherwise wouldn't have is something that, you know, I feel really lucky to be able to do. And that doesn't necessarily have to be in another country. I mean, there's tons of underserved areas in the US alone that nurses are really the ones who are taking that on that responsibility to be able to provide that kind of care that they otherwise wouldn't get.
I completely agree with you. I want to remind the audience that we have a CNO, a CRNA who's in the OR all day, a nurse practitioner at one of the busiest emergency departments in the entire metropolitan area, and a research APN at University of Chicago here on the call. I have to ask for myself out of curiosity, with such stressful careers, especially this past year, when everyone I feel like has felt the intensity of our roles more than ever, how do you find a sense of balance? And what recommendations do you have to others to find a sense of balance while also pursuing your career in nursing?
Work-life balance is very important, and not just for myself, but I always, you know, teach my team to have that work-life balance. During the pandemic, I think that taught us all that, you know, life is short, and we need to take some time to smell the roses, as they say. Take some time for your family and friends and things that are important. You need to take some time to rejuvenate. Sometimes when you go constantly, that's not best for you, and that leads to burnout. During the pandemic, it was a point where I had no days off for a consecutive number of months at a time. And even for the strongest nurses, that can be quite challenging. So you have to decide what keeps you rejuvenated, whether it's meditation, yoga, exercise, you know, spending time volunteering, going to your church. Whatever the case may be, you have to set some time out of your busy schedule to make time for yourself, because you cannot be productive for others when you do not rejuvenate. So I probably learned that best this year in this pandemic. You know, I'm one of those ones that say yes to, can you speak here? Can you do this? Can you write this? Can you review my resume? Can you give me a reference? And I'm like, yes, 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 yes. But sometimes you do have to really take some time for yourself and travel. I like to travel. When I travel, I like to snorkel. So I've scheduled that time on my calendar to take that time off, because if I don't, I'll keep going work-life balance in our career is very important, and you can't feel bad for that, because then we have other issues that, as we all know, as nurses, that may lead to some mental health issues if we don't take that time for ourselves. So that's very important, and no one should feel guilty about that.
I agree, and I don't know if anyone else can relate or not, but I do also feel like the experiences that we've had as nurses kind of give you an outlook on life that really makes you want to make sure that you enjoy it outside of work, right? There's much more to us than just work, and while nursing as a profession is super important, I also want to make sure that I'm able to be the best that I can for the patients, and in doing so, I have to kind of make that time and set that time aside to take care of myself first.
So what do you do, Dr. Trivio, to
Oh,
find a
I
sense
like
of
to
balance?
I like to travel as well. Well, at least before COVID, traveling
Right.
as much as I can now, virtually traveling. I also just stay active, play volleyball, sports, and all those different things too. So
Dr. Soko, Dr. Alue, how do you find a sense of balance? You're muted right now, just so you know, Dr. Soko.
Barking, so I had to mute. Yeah, I feel like the support system that I have around me really does help me. It forces me to make sure that I'm balancing work and everyday life, not just being a mother and a daughter, but also just being an individual with not related to nursing at all. So I'm lucky to have support around me that really helps to remind me. But I've noticed, and especially in this past year, professionally, we've really identified so many colleagues that, and we're seeing the effects of it actually now because we've had a lot of staffing issues and burnout issues and almost like, not, I don't want to say apathy, but just exhaustion. Where initially, when COVID came out, we were very united and very supportive of one another because we knew that we were the front line and we really had to kind of be on top of things to make sure that things move forward. But after a while, I think we have to recognize that the response that some people do is just they internalize everything and they feel like if they are complaining or they're asking for time off, that they'll be looked at as weaker or not able to tolerate adversity. And so that's definitely not, I think we need to build an environment that's very supportive and that acts against that and identifies areas where we say, we recognize it, we know that you're having a hard time, please make sure that you're um, taking care of yourself. So really building an environment that encourages each of us to take care of one another and ourselves. So um, I've been more conscious of that and trying to really incorporate that, especially as our particular group grows, that we really need to make sure that we're watching out for one another because it's easy to just kind of get on that hamster wheel and keep running, especially when people are looking to us to take care of everything. We have to recognize that we can't do it all and to keep a check on one another. But yeah,
I
I like
agree with you. I think there is something to be said about scheduling things, like Dr. Coleman was saying, making it required. Respite care and self-care is just as important as our patient-facing care. Dr. Rita Alaway, how do you find balance?
Uh, just a little bit follow up. I echo everything everyone has been saying. So it's been very challenging at this with this pandemic, but one still have to remember that there is life beyond work, like family, your community, and I also believe in prayers. So praying every day, making sure that you are meditating. It taught me to be more mindful of being of having balance in life with work. Like I need to balance both. So that's how I dealt with it during this pandemic.
Thank you so much.
Mhm.
I want to remind the audience, if they have any questions, they're welcome to put them in the chat window. So as the title of our panel is Nursing Pathways from Bedside to Policy, the next question that I have for all of you is, how have you helped influence policy, whether that is in your work environment or within the nursing profession?
Well, I myself, I do sit on several nursing boards, and some of those boards do have ability to influence policy and send letters to our legislators, and also like the Illinois Hospital Association. I do stay current with ANA and ANA Illinois to understand what's going on, and I do send out that information when I get it to even my stakeholders, even the nurses at the bedside, not just the leaders. So they're aware what's going on in their state. I've been influential, just not also internally in my organization on changing policies or procedures, but sitting on these boards and being in community involvement helps me to be a part of policy and being an advocate in healthcare for healthcare organizations and the communities at large, and even academia.
Sounds like part of what you're speaking to is the importance of nurses at the table with regards to shared decision making. And I couldn't agree more. How can we best advocate for our patients' needs without having nurses directly involved in policy? Are there any other panelists that would like to comment on this question, how you have influenced policy in your work environment or in your profession?
So for me, as a family nurse practitioner and a researcher, I have an intimate knowledge of the patient and their health status. And these are the key factors in shaping any health policy. For example, at the onset of the COVID-19 pandemic, I had the opportunity to participate in research activities centered around coronavirus. Through these studies, I was able to directly inform patients on how this deadly virus spread. I was also able to work on COVID-19 vaccine as a preventive measure, and also report findings from our convalescent plasma therapy. So I echo everything that Dr. Coleman have said earlier on. That is one noting that like nurses in the past have not been known to contribute to policy, but times have changed now, and I think now that we are getting up our DMP program to speed, I think that's really has helped a lot.
Thank you.
Thank you.
I'd also like to kind of echo that too. I recall when even I was in the application and interview process for school, one of the questions that they had asked me was, are you familiar with the different types of political things that are affecting our profession on a day-to-day basis? So that's something that kind of, I guess, encourages people who are interested in advancing their profession throughout nursing to kind of make themselves a little bit more educated and aware about as they continue in their process towards doing so. At the same time, throughout our school, we were able to take a trip out to both Springfield as well as Washington, D.C. To help lobby for our profession. So there, when you go there, you have an opportunity to meet with both state and federal representatives that have the ability to directly influence our day-to-day scope of practice. And so we go out there, we spend a day or two educating these representatives on what it is that we do, what it is that we're capable of. We discuss our education as well as our clinical training in hopes of continually advancing our practice. At the same time, when we're not able to go out there, we make sure that, we take the time to donate to the appropriate governing bodies that help advocate for our profession when we're not able to be there to represent ourselves. The other thing I also wanted to add was during our curriculum, we also have a DNP project that is a required part of graduation. And oftentimes these projects, the purpose of these is to make some sort of contribution into the information of our profession. And oftentimes these projects ends up being candidates for publication. So I would say that's also an opportunity to influence the profession and contribute to its ongoing advancement.
All impressive. My small contributions have been more recent, I would say, but as I had mentioned in my summary of my trajectory, a lot of my contributions have been more at the organizational level in terms of advancing our practice and our scope of practice in terms of what we can do within our department for APRN. But more recently, I was lucky enough to be invited and involved in one of the biggest COVID national studies led by Dr. Simonovich in terms of how the impact of COVID with nursing and how they practice, particularly, especially with PPE and distribution and allocation and policy, and how that's been used within institutions. And so that study has the studies that have come out of that research have really helped influence, hopefully, the policy and how information is communicated amongst nursing and healthcare professionals, especially during a pandemic, and even how PPE is distributed and allocated when we're in times of crisis. So research has definitely helped me be more active in policy development and influencing in that. But then mostly, like I said, my contributions has been focusing more on organizational, influencing them on trying to advance the practice and support APRNs within the institution with program development and collaboration with our colleagues. So.
Thank you so much. I'd like to thank everyone for their attendance at tonight's panel. Our closing question for all of the panelists, if you could each respond individually, is what advice do you have for someone who is interested in following your specific career path that you've laid out this evening?
Well, as a CNO, following my career path, I would definitely most foremost say that it's very imperative to get that direct patient care experience, even if you're going into leadership. I think because of my years as an ICU nurse, that has greatly helped me with still to this day understanding the practices, understanding policy, and understanding how you really need to take care of a patient. So I would encourage anyone going into leadership to have some time at the bedside, regardless of the specialty, to really hone in on your patient care skills and knowledge. And then as you do that, I would encourage always continual education. We're all lifelong learners. We're never going to stop learning, especially in this healthcare profession. So, and then the other thing that I also would encourage is professional development. Any webinars, seminars, classes that can be taken will help to reinforce leadership skills that are needed to be a CNO.
I'll go next. I think one of my pearls that I would pass on is identify mentors early and stay connected with them. They can give you insight that you might not be able to see. They might be able to identify things in you that you might not even recognize in your current practice. And so identifying mentors, whether it be in the area that you are wanting to specialize in, but also mentors in areas that you're not really familiar with. I have found great mentors during my DNP program that I plan on cultivating that relationship lifelong. So these are things that you kind of want to open yourself up to and don't pigeonhole yourself into one area. Kind of keep your mind open to different interests, because if you pursue things with humility and sincerity in anything you're interested in, opportunities will come to you because people can recognize sincerity and hard work. And so I think those kind of opportunities will come to you as long as you're really honest about it. People will recognize it and find you.
So for me, my advice to anyone interested in clinical research is to first try to get some associated clinical experience and or skills that can be leveraged in the research area they're interested in. And I will also encourage, like one of the panelists just said, I will also encourage that you find a mentor that will guide you so that you are able to maneuver efficiently throughout the process and avoid any pitfall. Earlier on, I think Dr. Coleman mentioned something about joining the nursing organization, even as a student. I think is very important. I think they should make it, I think nursing school should mandate it, that we should be able to chip out some money to be part of this organization even before we graduate. I think it's very important that we be part of the nursing organizations that will really help us to shape our policy and career. Thank you.
I'd like to add, like from the standpoint of preparing for CRNA school, I would say the biggest thing would be to plan accordingly. CRNA school is unique in that you're physically incapable of working throughout the clinical residency portion of your program. So making sure that you are both financially, physically, socially, and emotionally prepared to undergo that for the next 2 to 3 years is something that's really important. And part of what goes along with that is making sure that you surround yourself with a really good support system. You also want to make sure that you get your routine prior to starting school. So that way, as you're going through the rigors of the program, you kind of have some sort of routine and schedule that you set aside for yourself in place. Prior to starting school, I would really say to maximize your clinical experience as much as possible and really become an expert in the field that you're in. Volunteer yourself to take care of the most complicated and the sick patients that you can. Be as involved as you can on your unit and look at the different ways that you can contribute to your practice there on the unit and something in other ways that can affect other units as well. And most importantly, don't be afraid to ask questions, because I think it's one of those things where you can't let your pride get in the way. And ultimately, if you're not afraid to ask questions, then ultimately it's going to be in the best interest of the patient to make sure that you kind of care for them in the best way possible. So I would say plan accordingly and really just be the best that you can throughout your experience at the bedside.
Thank you so much for your responses. Well, Dr. Coleman, Dr. Alue, Dr. Soko, and Dr. Toribio, we are so thrilled to count you among our distinguished alumni from here at DePaul University School of Nursing. And we thank you for your sincerity and for sharing all of your hard work with us this evening.